Hi, Kevin Henry, the Group Editorial Director for UBM Medica's Dental Division, and I'm on a Google Hangout today with Jan Palmer. How are you today, Jan?
Good, thanks, Kevin. How are you?
I am doing great. I was wondering, do you mind just kind of introducing yourself a little bit to our viewers?
Not at all. First of all, let me start by thanking you for having me today. I really appreciate this. About me, I am in the world of dental sleep medicine, which is the new hot topic in dentistry today. I started this back in 1999, and back then we were pioneers. Nobody was doing this type of treatment in the dental office, so I really had to get in the trenches and learn it. So I decided after several years of doing this, I was going to share my knowledge. So I have been training offices, and also I am a remote employee of an office in Boston, and we only treat patients with sleep apnea. So I'm still in the trenches with it, and I learn things every single day.
Well, let's talk a little bit about that, and let's talk about how a dental practice kind of works to treat a medical condition. How does that work for dental practices?
Okay, well, first of all, this is a medical disease that we're treating, obstructive sleep apnea. There's a lot of clinical information out there for the doctors to get up on. We treat it in the dental office because the oral appliances that we're fabricating are intraoral, so therefore they need to be performed in a dental office by a qualified dentist. So in order to do that, the flip side of it is that because it is done intraoral and it's a medical condition we're treating, it has to go to the medical insurance instead of the dental insurance, and this is where a lot of offices get hung up.
And I bet a lot of offices also get hung up whenever it comes to the insurance side of things. So how does that work with this condition that needs to be treated?
Absolutely. Well, first of all, the doctor has to be trained, of course. You don't want to do anything outside of your licensure, that's for sure. Once a patient is diagnosed, there's basically 5 steps to follow. You're going to verify the patient's intake information, their name, address, birth date, insurance information, and then you're going to call and verify their benefits for medical. And it's a little bit different than dental insurance. Of course, there's still network adequacies that you have to come by, and there's sometimes gap exceptions where they pay you in network when you're not, but that's a whole nother story. After you verify the benefits, then you're going to do any pre-service review that's needed, such more like a predetermination like you would with dental. Basically, it's the same. And after that, you would see the patient, do the service, submit the claim, and then you follow up with the claim and make sure you get covered. It's easy when you break it down into those 5 steps.
So Jan, I know obviously the team's going to play a big part of this. What are some of the big steps that they need to know about having this in their practice?
One of the first things is that the team needs to understand the disease. They have to know the basics. They don't need to know the clinical aspects as the dentist does. That's under his licensure. But they need to be able to communicate with patients and answer questions. When the patient calls for an appointment, they have to be able to answer the questions. That's the easier part. The harder part is the first question out of patient's mouth is, how much is this going to cost me? Does my dental insurance cover this? And the team members have to be knowledgeable to be able to answer the questions correctly.
And so where do they get that knowledge? Is that just from training? Is that where's a good place to start?
Well, there's a lot of services out there that are willing to teach offices to do this. A lot of offices are outsourcing their medical billing so that they don't have to do anything. The office has to just collect information and send it out, and they don't really have to answer any of the questions or understand any of it. As far as other training, there's the Academy of Dental Sleep Medicine. They are a nonprofit group. They run the biggest sleep group in the country. They have a lot of information that is there. And because they're nonprofit, they're not trying to sell you anything. They're just giving you the education. There's also consultants such as myself that go out and they do train in the dental field in individual offices and kind of guide people through this.
We're going to have Jan give her contact information after I ask her this last question. That way you all can reach out to her for any questions you all might have. But let's talk a little bit about Medicare and how this fits in with this. What's the configuration? How does this work for practices?
Okay, the dentist can no longer ignore Medicare. You're now considered oral physicians by Medicare, therefore they know you're there, you have an NPI, you're on their radar. You have to declare something by June of 2017. You can become an ordering and referring provider, and that gives you no billing privileges. However, if you write a prescription or you send a patient out for testing, that will be covered. If you're not at least ordering and referring and you send a patient out for a CT scan or a biopsy, that wouldn't be covered because you're not in the Medicare system yet. Your next choice would be to opt out and basically you sever all ties with Medicare. There's pros and cons to each of these. There's a book on dental at dentalcodology.com. If you wanted to look at that, there's some excerpts that you can read and gives you an idea of what you need to do. You can become a participating provider for both Part B and DME, where you accept assignment as you would be participating with any insurance, and that's usually more if you're going to be treating TMJ or sleep apnea. And then you have the DME aspect, and again, you can be participating or non-participating. There's a lot of different aspects, and there's a lot of education out there with Medicare. Just look up your local Medicare site. If you go to cms.gov and click the link under Medicare, it will guide you to just about anything you need to know.
So Jan, if our viewers have any questions, where can they reach out to you to get some more information?
They can shoot me an email if they'd like. My email is jan@dentmedins.com. That's jan at DENT as in dental, MED as in medical, INS as in insurance.com.
Sounds great. And Jan, I know you and I will be talking in another Google Hangout about kind of how to start the conversation about sleep apnea. So I'm looking forward to that. And thanks so much for your time. I appreciate it.
Thank you, Kevin. It was a pleasure.